being studied. And now that we're talking of vaccinations, another question which everyone wants to know about is the booster jab. Has South Africa started with it? Do you think we need it? Specifically with India, as the double dose vaccinations are currently on, do you suggest a booster jab also for the population?
I suggest that, especially your vulnerable groups, your 50-plussers,
Okay.
people vaccinated more than 3 months ago, you know, that because that's what we see.
And okay, so you're saying that the age will be a factor. Can you also add who else do you think will need the booster jab? And how should we go about it as and when India decides? What do you think should be the criteria first, and then we go to the general population?
So it would be your healthcare workers, people working in the healthcare center, because you cannot afford to lose them. Then it would be people with immune-compromised disease under 50 years, and people under 50 with severe obesity and other chronic diseases. That would be the target groups, because these people, you know, if they get sick, you never know whether they get mild disease, whether they get severe disease. There's no ways that you can determine beforehand, but you know that they are your risk group. So you need to get your mitigate your risks as much as possible, and then you keep on moving simultaneously. Get as much jabs in the arms as possible for the first timers who have not been vaccinated.
And right now, because the RT-PCR is primarily the test to have this variant detected, is the Omicron getting detected in the RT-PCR? What are the doctors in South Africa suggesting? Do you think that even in India, we must continue with the RT-PCR test for now?
Yes, it is still detecting. We are using it. We're also using rapid tests, especially in the first 5 days. And thereafter, we go to the PCR, the lab PCR. Yeah.
Okay, so you're saying the Omicron is getting detected in the RT-PCR as well. Okay.
Yes.
So, Doctor, now let's come to one of perhaps the most crucial, significant category, and that is the children. I do understand that in South Africa, at least to a certain level, the children have started to get vaccinated. Do you see a difference there? How are the children who are getting COVID positive are responding? How are they being detected? And what would you suggest to India, which has not yet started vaccinating children?
So we started with the age group 12 and older.
Okay.
We haven't seen a lot of them coming in. However, the younger patients coming in will complain of a sore throat. They have a bit different symptoms than the 20-plussers. So they will have the sore throat predominantly, and they might have a fever, they might have a slight elevated pulse, but and they might, you know, look ill, acute ill. But I promise you, then the majority of them, within about 3 to 4 days later, you will not believe that was the same child that you have seen. So that the recovery rate is very